All right, guys, let's get into Module 2, Anxiety Disorders, Deep Dive. When we think about anxiety, we can almost think of it as like a tree. If the entire tree is anxiety, the branches of that tree might be the subcategories of anxiety or diseases of anxiety, which we're going to dive into now. Let's start with agoraphobia. It's defined as an anxiety disorder marked by fear of certain environments or situations that could cause panic, leading to feelings of confinement, powerlessness, or humiliation. An example of agoraphobia could be someone that's afraid of a public restroom or public transportation. They're afraid of closed spaces or big open spaces. So agoraphobia is a very specific disease of anxiety. Secondly, anxiety disorders resulting from a medical condition can be defined as the experience of heightened anxiety or panic symptoms directly attributed to a specific physical health issue. So someone might have heart disease or diabetes or thyroid issues, and it's that medical condition that creates a heightened anxiety or symptoms of panic within a person. Generalized anxiety disorder, which is what I believe I have, is excessive and or persistent anxiety that goes beyond the usual and disrupts physical well-being, often accompanied by anxiety disorders or depression. When you look into some of the medications that are indicated for anxiety, namely SSRIs, they may be indicated for both anxiety and depression, and anxiety and depression typically go hand in hand. But if we're thinking about generalized anxiety disorder, we could think about the idea that we all have everyday stressors. We all have everyday things that we go through that create a heightened sense of anxiety. However, someone that has generalized anxiety disorder might have a persistent anxiety that just goes beyond feeling stressed or feeling kind of situationally anxious. Panic disorder, recurring episodes of intense anxiety, fear, and sudden panic attacks that peak quickly and lead to a sensation of impending doom, breathing difficulties, chest pain, or a rapid heartbeat. Panic disorder can be brought on by anything. And typically, if someone experiences a panic disorder, they usually want to avoid that item or that situation in the future because it's such a traumatic event that one can imagine if you're having breathing difficulties or chest pain or a rapid heartbeat because of a specific environment or event, you would in the future look to kind of remove yourself from those situations. Selective mutism, a condition where children cannot speak in certain situations or settings like school, but have no problem speaking at home. Separation anxiety. Separation anxiety disorder in children is characterized by intense distress and anxiety caused by being away from their closest family members or individuals they are most attached to. These children fear the possibility of getting separated from their family or something negative happening to their loved ones when they are apart. Examples of separation anxiety is a child who refuses to go to school or a child that refuses to be away from a parent, that typical parent that they feel most comfortable around. Specific phobias, intense anxiety and a strong urge to avoid a particular object or situation. Examples might be afraid of animals, afraid of situations like fear of flying or fear of being in a tight space. A specific phobia could be medical treatment, like the fear of a dentist. It could be environmental, like the fear of lightning or fear of being in the ocean and this type of thing. These specific phobias affect people in their everyday lives and are absolutely on the tree of anxiety. Substance-induced anxiety disorder. Anxiety or panic directly caused by substance misuse like medications, drugs, some type of toxic exposure, other specified anxiety disorder, and unspecified anxiety disorder. Conditions involving anxiety that doesn't fully meet the criteria for recognized anxieties, like the ones that we just mentioned, but still have a significant impact on a person's life. Next, some might say, well, what about PTSD, post-traumatic stress disorder? And I really dug deep with my research on PTSD and found that in the medical community, PTSD or post-traumatic stress disorder refers to a psychological condition that can arise following exposure to highly distressing or traumatic events. Obviously, people that have been to war or people that have had significant abuse, and this creates mental health challenges in their life. But with respect to whether or not it's an anxiety disorder, I did find a study titled Post-Traumatic Stress Disorder and Anxiety-Related Conditions. And in this study, it was found that PTSD is no longer considered an anxiety-related disorder in the DSM-5, the Bible in the medical community of mental health disorders. It is now categorized as a trauma or stressor-related disorder. And lastly, what about OCD or obsessive compulsive disorder? It's defined as a mental disorder that affects people from various backgrounds and ages. It involves being trapped in a pattern of distressing obsessions, unwanted thoughts or images, or compulsions like repetitive behaviors, like before opening a door, maybe twisting the doorknob repeatedly. They do this to alleviate the obsessions and reduce the distress. The DSM-5, which is, again, the Diagnostic and Statistical Manual of Mental Disorders, largely considered the psychiatric Bible, separated OCD from anxiety disorders. In a recent article in the Psychiatric Times titled, "Is it OCD or an anxiety disorder? Considerations for differential diagnosis and treatment," by Drs. Falk and Goodman, it states clearly in this particular article that in 2013, DSM-5 separated OCD from anxiety disorders by creating a distinct category of OCD and related disorders. Let me read. In 2013, DSM-5 separated OCD from anxiety disorders by creating a distinct category of obsessive compulsive and related disorders. While the diagnostic criteria spell out differences between the categories, phenotypically, the presentations of OCD and anxiety disorders, such as social anxiety disorder and specific phobias, can appear very similar. So though the medical community has now separated OCD from anxiety disorders, largely the symptoms can appear very similar. Let's move on to Module 3.